In healthcare, we have to give the patients the best outcomes scientifically, medically, rendered with compassion and kindness. That if all caregivers, doctors, nurses, X-ray technicians, and everybody treat every patient as if we are the patient, the answer is there. Therefore, the foundation is called The Patient Is You, TPIU.
I would like to speak to the many doctors in our lives. At some point in your life, whether it was when you were a child or perhaps a student trying to choose a career path, you decided to become a doctor. I'm sure there were many factors that influenced your decision, but I would like to think that the overriding thought was that you wanted to help people. I know it was not an easy path. There were many hours of study, long medical rotations, job frustrations, dealing with insurance, financial stress, and the demands of life. There are many wonderful doctors who are truly committed to their profession. I have been blessed to have had two remarkable doctors in my life. I received excellent medical care from both of them. But what I remember most is the kindness and the compassion with which I was treated. I was not one of many patients. During my visit, I was the only patient that mattered. What is it I expect when I need to see my doctor? I don't want to be told that there is a 3-month wait when I am concerned about my health. I don't want my doctor to order another round of blood work when I just had the identical test done by another doctor. Take the time to review my medical history. I don't want my doctor to order unnecessary test. And if a test is ordered and I hear that the results are in, don't make me wait a week to get the results. Waiting is so difficult. Most importantly, I want my doctor to really be present for me, to listen to what I say, and perhaps what is left unsaid, my underlying fears and concerns. I choose my doctors for their medical expertise, but I also expect kindness, compassion, and honesty. I would like all doctors to look back into their past when they were that child or that student and remember what thoughts fueled their decision to become a doctor, and try hard not to lose sight of the most important person, the patient.
When patients are treated with compassion, and when they know we are trying to keep their medical costs down, yet provide them with the best possible care, they treat our staff and providers with kindness and cooperation, which creates a healthy environment for both patients and providers.
We always remember that, and we treat our patients just like they're our family members, and make sure that we can do everything we can to make them as comfortable and secure as they can be. And I think that really helps with their overall experience, and just to make the most and the best of everything that we do for them.
And it makes me feel happy to know I've either given somebody something good to happen, or something good that happened in their day, or maybe if they were sad, I was able to give them a hug or hold their hand, and that person might have left a little more at ease. Is it extra work? It can be a little extra wearing, but it's worth every minute of it. If I could give any advice to somebody, treat that patient as if it were you on that table, because someday it could be.
So TPIU Foundation has two missions. One is to care for the patient. The other is to care for the caregivers I think that is very important to take care of both parties.
My hope is that we can help our healthcare providers in Connecticut obtain the proper support so they can provide compassionate, cost-effective healthcare to their patients and help our community learn how to navigate safely through our complicated healthcare system.
What is the most important in healthcare? The patient. Taking care of the patient, both scientifically, medically, and with compassion and kindness, is the only thing we should remember. This foundation, called Tpiu, is to treat every patient as if you or your loved one is a patient.